our Secretary Saiba, Dr. Shehzad Saab, they were all very in time here. Given the nature of topic, really, we wanted to listen you, to have your thoughts. We just don't want this launch for the sake of launch. It's not that one report is there, printed, published, and launched and gone. We really wanted this a beginning of the discussion, because you see the title, it's so critical, so important, Drought and Deluge, the silent sufferings. So that is the key term, the silent sufferings, the women's and the girls in climate change. When we were writing this study, authoring, you may have a feel that we know this. This is known to us. You may feel that there's nothing new in it, because the problem is so deep-rooted, so widespread, that we every day talk this. Every one of us feels it. But sometimes the idea is that in disasters context, maybe we need to further deepen the discussions around it, to bring it on the table of the policy agenda. So this is there in daily routines. But when it comes to disaster responses, rehabilitations, protections, given the other priorities, the emergency, the nature of the crisis, sometimes the suffering go unnoticed. So that is the single point contribution, if we can make, that bringing these silent sufferings on the table of policymakers, the execution agencies, PDMAs, the NDMAs, when they are designing their programs, integrate these sufferings within the responses. So that is the one. Secondly, and most probably lastly, any findings in no way is an assessment of all the stakeholders, those who are here around the tables. We have UNFPA, we have PDMAs, we have NDMA, we have NCSW, we have health services, we have development partners, ADB, ILO, UNICEF, UNIDO, and other partners. So whatever we will be presenting you is to highlight these sufferings, so that when you sit on your table, you design your program. So that was from my side, and with a bad throat, actually. My apologies that I was in Lahore and I trusted more on smoke guns. They didn't help me a lot later. So blind trust sometimes hurts. You don't. So with this, again, just reiterating our thanks to UNFPA, who is leading all this initiative, and has been the most sane, most powerful voices on integrating women, girls in mainstream policies. The one idea of this discussion is also to move away from this pattern of a residual focus on gender and mainstreaming it into the policies, all policies. But this is what we call gender in all and all in gender approach. That will be the key approach here. So today's session is divided into two sub-sessions, some technical presentations. One is the study presentation, the other is the action plan that Dr. Rashid, our colleague from UNFPA, will be presenting, speaking more on it, that what exactly needs to be done, who has to do what, that has been chalked out. We would like, and that has been chalked. And finally, the study has been through a complete process. We have had consultations, NDMA was there, PDMAs were there, all provincial other agencies were there. So based on the findings, based on the analysis, based on the feedback, the study is being presented to you. But this is just beginning. That is my last sentence. This is just a beginning of this debate, we will continue following you. So with this, let me invite our guest today for the opening remarks, Dr. Gulnara, Deputy Representative, UNFPA, Pakistan. So Dr. Gulnara, if you can join us on stage for your opening remarks, please.
Good morning. Assalamu alaikum. It's a great pleasure to be with you today. Ms. Humaira Zia Mufti, Secretary National Commission of Status of Women, Dr. Shahzad Ali Khan, Vice Chancellor, Health Service Academy, Mr. Idris Mahsoud, member of DRR and DMA, Dr. Aisha Sani Majid, DG Health. Ladies and gentlemen, that's my actually almost 2 months I'm here in Pakistan, and I'm truly amazed by the work of academia, civil society organizations, by the government, and all the commitments to support and advance our programmatic agenda as UNFPA. In the recent floods in Punjab, a mother was forced to give birth to triples in a vehicle after flood waters cut off access to the nearest hospital. Tragically, all 3 newborns died before medical assistance could reach them. Heartbroken, the mother said her babies might be survived if the help had arrived sooner. This is from the media report. This strategy is a stark reminder that climate change is one of the greatest global health and intergenerational injustice of our times. It is disrupting livelihoods, undermining economies, and threatening the health and well-being of communities. In Pakistan, evidence from floods and droughts consistently shows that women and girls bear the heaviest burden during the climate-related disasters. The Post-Disaster Needs Assessment 2020 to 2023 reported that protection risks for women and girls were extremely high in flood-affected areas, compounded by a lack of reproductive health and protection support services. So we as an office organized a study to gather evidence on the gender-specific impacts of climate change, with a particular focus on how it affects the sexual reproductive health of women and young girls, and the increased exposure to gender-based violence. UNFPA, in partnership with the government of Pakistan, has long worked to strengthen institutional resilience and safeguard the rights of women and girls before, during, and after the crisis. And collectively, with the government, other UN agencies, academia, research institutions, and civil society organizations, we aim to build adaptive and resilient health systems that are capable of delivering uninterrupted reproductive health services, strengthen community-based protection mechanisms against gender-based violence in disaster-affected communities, and provide timely and comprehensive support for survivors of gender-based violence, to invest in emergency preparedness and resilient data systems that capture the disproportionate impacts of climate change on women, girls, and marginalized groups. We deeply appreciate for our partnership with Ms. Ramina Khurshid Alam, coordinator to the Prime Minister on climate change and the Minister of Climate Change and Environment Coordination. We extend our sincere thanks to all our partners who are present here, who are not present here, but who are for their commitment and hard work in advancing the rights and resilience of women and girls in Pakistan. And to add to it, that I'm coming actually from very diverse background and in different capacities as a management, but also as a statistician, as a researcher, you name it, as a doctor. And the issue of climate change impact becoming absolutely prominent in all the political and national discourses, because it's absolutely vital how the institutional systems and community systems are more adaptive, resilient, and more responsive to these disaster-prone areas, to some recurrent shocks which are actually driven by the climate change. But it's also related to any disasters. It's we are talking about Pakistan, and this day I see that Pakistan is very diverse in terms of challenges, security-related challenges, and challenges related to climate-related pollution. I came just from Lahore, so it really has also impact on the health and well-being of population, with our prominent concern on women and girls as well. So I really congratulate you with this study. Thank you very much, Shukriyan, and I wish you a very productive discussion. Thank you very much.
Thank you, Dr. Gulnara, and welcome to Pakistan. Thank you. Ladies and gentlemen, we will be now inviting a technical presentation around the study. But with the one message that we continue to listen, that in disasters, this is very difficult to focus on these issues like SRH, family planning, because the cost is the lives. But at the same time, the message from us is that this is the most important time to prioritize these issues, because the cost is the life again there. You see, this is from the ground, the women we interviewed. And if you can see, with no healthcare available nearby, she endured an arduous journey on a wooden boat to reach a hospital, but the delay led to the loss of their twins. So on the cost are the lives there as well. So that is the message that UNFPA is bringing through this study, that this disaster is the most critical time when we have to prioritize the issues related to women and the girls. So with this, let me invite the author of this study, one of the authors of study, to take us through the key sort of landscape, what we learned in this one. Dr. Muhammad Rafi Amiruddin is a professor at ComSats and has been long working on issues related to gender. So Dr. Rafi, over to you, but with 12 minutes in your hand. So just run us down.
Assalamu alaikum. Thank you very much. It's not working. Okay. Okay, next, please. Thank you. Okay. I believe that the consequences of the climate change for Pakistan are all too well known, especially the catastrophes that we have been witnessing in the recent years, especially in 2025, that leaves us with little doubt that we are right in the middle of a crisis. And if we fail to take the timely action, the price would multiply. And as Dr. Sajid has just highlighted, the cost, this is not just numbers. Basically, each number, each fact and figure, this is a tragedy. And a timely action makes it possible to avert these tragedies. So, but just to put things in a little context, so here are some of the most telling statistics, that Pakistan is the 10th worst country in terms of the victim of the climate change. And the recurring floods and droughts, they are threatening lives and livelihoods. So Pakistan's, given the vulnerabilities of Pakistan, economic and others, so these effects, they are definitely much worse than are generally believed. So women bear a double burden as climate shocks intensify health risks, disrupt reproductive care, and compound existing gender inequalities. So we have a patriarchal social system, and women are generally less empowered, and they face other type of disparities, but in the times of crisis, these disparities, they multiply. Okay, moving on to just a little other reminder why this study is important, because climate extremes are escalating in Pakistan and women bear disproportionate physical, social, and economic burdens. And disasters disrupt maternal health services and increase GBV risks. Okay, this is basically a very simplified version of potentially a very complex story, a very complex mechanism through which the climate changes, they affect the lives and well-being of the women. So let's just break down the climate change to just two factors. So potentially they are much more complicated, but for the time being, we are focusing on just two things. One is the floods and the other is the droughts. So the floods, they may not necessarily dent the economic well-being initially at least. So the first effect that generally is faced is the displacement and infrastructure damage. So economic damages that come after that. Okay, as regards the droughts, so basically it is a slow-moving crisis, and it leads to migration and social dislocation. Okay, and at this stage, displacement and infrastructure damage, as well as the migration and social dislocation, they lead to, different types of outcomes. So if we focus on displacement and infrastructure damage, that tells us that service and supply chain, they are disrupted. And then droughts also affect the resource scarcity and economic hardship. And also the GBV exposure is heightened during these crises. And all these, when they combine, they affect the access to the sexual and reproductive health, as well as the family planning services. Now, what compounds and makes this, complicates this picture much more are the existing gender inequalities in Pakistan that are too obvious. So, one crisis is caused by the climate change, and the existing gender inequalities, they further compound it. Okay, these are the four objectives of this study. The first one is to analyze effects of climate change on women's SRH, FP, and GBV services, access to them, and examine socio-economic and geographic factors of vulnerability. So I would explain the methodology, why these crises are, they have the very anticipated, they have geographic dynamics as well. So generate policy debate on gender responses to disasters. So this particular object is relevant to this session. So, and recommend gender inclusive disaster response action plan. Okay, so this is just a snapshot of the study. And here we have taken 8 districts from Pakistan for this study. So why these 8? Basically, these are considered to be the most vulnerable to droughts and floods. And these have been ranked by NDMAs and provincial PDMAs to be the most vulnerable, especially in the context of 2022 floods. So we have Dera Ghazi Khan and Rahim Yar Khan from Punjab, and Dadu and Umar Kot from Sindh, and Zob and Chaghe from Balochistan, and Charsada and I can't really. Yes, exactly, correct. So these are our sample districts. So on the left, you can see this is a multi-stage cluster sampling, just to make sure that our sample is representative and there is a statistical rigor here, so that we do not leave anything to chance. So many different stages, starting from the choice of the districts and the tehsils, and then union councils and villages and households and respondents. And our sample is the women 15 to 49 years old women. And we, apart from the survey, we have also gone through the focus group discussions. Just to add another layer of rigor to our statistical analysis, we have also included in-depth interviews and case studies. So there are two case studies in the study. One is GLOF and the other is heat wave. Heat wave has been taken from Lahore and GLOF is from Chitral. Okay, these are some of the narratives. So basically, we have collected the data and we realize that numbers sometimes they cloud some bitter realities. Numbers we cannot, for some very complicated reasons, we cannot resonate as well with numbers as with the narrative. So here are just a few narratives. Dr. Sajid has told us one story in the beginning. There is yet another story. So after the floods, there is a woman from Zob, and she was the victim of the flood. After the floods, our house and land were gone. My husband became violent. He beat me while I was pregnant. My paralyzed daughter needed care, but with no doctor or clean water, she died. Later, I miscarried after another beating. There was no help, no clinic, nothing. So it tells us tragedies stacked one over another in the wake of the floods and climate change, the calamities. Okay, there is yet another story from Dera Ghazi Khan, again in the context of the flood. My family had to live on the roads for many days after our house was washed away. I am a mother of 5 daughters. One night, amidst the chaos, my daughters were abducted. We searched everywhere, but they were never found. So this tells us that the climate change, the floods and droughts, they are not just numbers. They are tragedies, and they are like written everywhere. So yet another story from Rahim Yar Khan in the context of the droughts. When conditions, this is the statement, our interview from the community leader from Rahim Yar Khan. So when conditions worsen, violence increases at home, conflicts start, and young girls are married off. Moving to new places with different castes leads to more sexual harassment. So it tells us very complicated story of our rural hinterland, how patriarchal norms they intersect with the disaster settings and what are the consequences. No doubt the tragic consequences for the women and girls. Okay, there are some larger, broader overview. In the context of 2022, 8.2 million women affected. If you just factor in like the whole population is 250 million and 8.2 million women. So this is huge number that went through different types of displacement, other problems. So 1.6 million required GBV support. Okay, there are some other telling statistics. 58% respondents faced floods, and in these 8 districts, and 35% respondents faced heat waves, and this is specific to Lahore in our study. And up to 77% faced challenges accessing family planning services, and 71% perceived increase in GBV after disasters. Okay, there are some other specific numbers related to gender-based violence. And here, let me explain it that these are not actually the experiences of the people. We have not asked women or respondents if they experienced gender-based violence or not because of the cultural reasons. So we asked them what is their perception, and 71% of them believed that there was an increase in the gender-based violence in the context of the disasters. And similarly, 39% women believed that there was a stigma in reporting gender-based violence, and 77% perceived increase in sexual violence. Again, the same caveat that this is not the experience of 79% women. So they believe that there is a perception. Their perception was that there is increase in sexual violence of some type. And then 49% believe that there was increase in physical violence. Okay, yet there are some other stories. How disasters deepen women's vulnerabilities. Only 24% of flood-related and 10% of the drought-related issues. In those contexts, women received medical support. So again, just to take the cue from Dr. Sajid's explanation that this is basically not a judgment. These are the perceptions of the people who actually saw things, observed things, and there is no way to contradict them. I mean, of course, we might like to look at this issue from many different angles. From policy perspectives, one might see that there is a lot more coverage on the ground, but maybe there is a mismatch. So 37% of flood victims and 48% of the drought victims lost income permanently. So this tells the extent of the problems, that this is not just like a one-time shot. The tragedy is stuck and they persist. And similarly, 29% reported medicine shortages, and only 19% in the case of floods and 9% in the case of droughts accessed psychological support, leaving older and disabled women isolated. Okay, there are some gaps that we have been able to identify, and I have just highlighted like what is the context, but there is a lot of overlapping. So you might expect that things also are relevant in the case of droughts. Weak enforcement of shelter and protection protocols. So the idea is not that these services are not available, but these services are missing, or at least the actual sufferers, they believe that they cannot access for whatever reason. So in the case of flood and drought, inactive gender-based violence response during relief phase. Again, the same explanation goes here. The idea is not that these services are not available, but in the context of the disaster, and in essence, this is the whole idea of this discussion, that we need to talk more about these services in the context of climate change related disasters. So disrupted health outreach and referral systems, lack of maternal transport and birth preparedness, and there's yet poor coordination between nutrition and SRA services in the context of droughts. So there are some other gaps as well that we have been able to identify. Limited GBV and protection services in migration areas. So we have these services in place in settled places, but when the populations, they are on the move, so things generally, the infrastructures break down and the health systems break down. And the whole idea is to pick, to provide the interventions in these contexts and include them and integrate these situations in our disaster risk management strategies. And there are some cultural stigma that limit reporting of violence. And this is all too well known, but this gets amplified during the crisis. So inadequate integration of WASH and GBV planning in the case of drought. And finally, the weak psychosocial and community safety support. So these are some of the gaps. So again, the idea is not to judge, but the idea is to provide a solution. And we have been able to come up with an action plan which actually suggests and proposes the ways through which we can move forward and find the solutions to these problems, which by any stretch of imagination are extremely serious for Pakistan. Thanks a lot.
Thank you, Dr. Rafi, for taking us through the study. Now let me invite Dr. Rashid Ahmed, humanitarian program analyst, UNFPA. But the commitment, the passion, that he has while working on this report and the action plan. You can call him humanitarian activist. That was the level of passion that we have to come up with a very doable action plan, friend. So Dr. Sheed, stage is yours with the one announcement that we have just been sort of noted by the Adris Mashood Saab, member DR or NDMA, that he's stuck in a meeting. He will be joining us once he is free. But we have all the PDMAs around the table. Definitely we'll miss NDMA, but Dr. Sheed, over to you for the action plan, please. Yes.
Bismillahir Rahmanir Rahim. Distinguished guests, ladies and gentlemen, Assalamu alaikum and good morning and good afternoon because it is 11:58. So without taking much time, can you please move to fourth slide, in fact, from now? Yeah, because all my discussion is around that particular slide. Yeah, further. Yeah, this is the one. Thank you very much. So thank you, SDPI, Dr. Amir, for this sharing with us findings of this study. And the study findings were so convincing and stories were so compelling that it really helped us preparing some key actions that I will share with you. But overall, our actions will be contributing to 4 key outcome areas. Number 1, resilient communities or community resilience, like strengthen individual and community resilience by investing in healthy, empowered, and educated population, so that women and girls specifically, their sexual and reproductive health rights are addressed and fulfilled. That is one key outcome area that we came up with. Second is resilient health systems are resilient institutions, which also include protection support systems. So in that, our health and protection support system should account for these changing climate threats. Then we came up with another outcome area, and that is like risk reduction, enhanced preparedness, and strengthened emergency response. And I will talk about those actions more in detail. Last but not least, very important outcome area is our strong data systems for climate vulnerability and adaptive capacity. So all these key outcome areas will be achieved through focusing on certain themes, certain specific areas, 6 of which you already know, those health system building blocks like governance, finance, data systems, technology, and so on, healthcare, human resource, health services, GBV risk mitigation, and supplies. Thank you, Dr. Dayar. Apart from that, some other key areas that are working as enablers. Is this slide clear to all of you sitting on the back seats? If not, then I have more details for this. So that is like, apart from those health system building blocks, where we also need to focus is vulnerability, capacity, and adaptation assessments. We need to conduct more focused research on the impacts of climate change on SRH, sexual and reproductive health, and gender-based violence related risk mitigation, prevention, and responses. Similarly, we need to have more of an integrated risk management and early warning system, again focusing on these areas, more research, as I said, more advanced technology engagement, particularly AI, and then management of these environmental determinants on health and SRH. So these are some other key areas. Now let me go directly to actions. We have designed these actions at multiple levels, initially focusing at individual, then moving to community, and then to institutions, and finally to systems and national levels. Can you now move to next slide? Yeah. So 8, individual level. Yeah. These are some of the actions. I will not go into the details of each and every action, but very specifically, we need women engagement in climate adaptation planning. Because of their knowledge in caregiving, they are the one preparing food for the entire household. They are the one who are interacting more with the livelihoods. So any loss at any level, they know how to adopt to those circumstances. And then there are other, like we have to identify and support community leaders, women leaders, youth activists, persons with disabilities, and other vulnerable individuals to ensure that their meaningful participation in early warning, disaster preparedness and planning, and finally response. Men and boys, particularly when it is about gender-based violence, their role is critical, particularly addressing stigmas and harmful practices in the communities. Women formal women role at leadership level, in the systems, in the institution is critical, but we shouldn't ignore their role, their participation role at the district level. Like their voice should be included in all those district level disaster risk reduction forums or bodies. And empowering young people is essential, both in and out of the school, and particularly linking climate change with SRHR, using life skills and comprehensive sexuality education as an entry point for building their resilience. Coming to community building, community resilience building is mostly working with the community institutions for building knowledge, awareness and capacity, and the links between climate-related emergencies and SRHR. In child marriage, particularly you all heard about these the challenges that we are facing, the communities are facing. If you heard the term monsoon brides, the child marriages followed by these early age pregnancies and consequences. So we need to engage community institutions for more awareness and information on these impacts. Epistemological convergence, like as I mentioned earlier, women know what to do for any climate disaster within their own capacities. But at the same time, we have this advanced technology in AI. If we will merge both to come up with some common early warning actions, preparedness actions, that will be helpful. Identify and address community access barriers. These are like gender and social norms, how these are challenging women in reaching out to these services particularly during these disasters. We need to address those barriers. Some of these examples are like transport and other cultural constraints. Train women groups and youth volunteers to record their local survival strategies and encourage women's formal representation in district and provincial level DRM bodies, disaster risk management bodies. Institutional resilience, the actions are mostly around institutionalizing SRH and GBB related services within the provincial and district level disaster risk management policies. That is something missing. Like recently, we concluded with this nationally determined contribution. We struggled a lot to incorporate gender sensitive, gender specific intervention, particularly with regards to sexual and reproductive health and GBB risk prevention and risk mitigation interventions into those nationally determined contribution. Similarly, we have national adaptation plans. Yes, SRH was included as a challenge, but we need to come up with these actions to make it part of these adaptation plans. Then, for domestic funds allocation, we have like at the institutional level these PC1 documents, like in Lady Health Workers Program, MNCH programs. So different is climate impacts on SRH and GBB and impact related actions, how to address these impacts. Funds for these actions should be included. strengthen the health system infrastructure, yes, the resilient health system, including the resilient supply chain systems. For instance, during COVID-19, most of these health systems were not receiving family planning medicines or contraceptive commodities during COVID-19 for good 8 to 9 months. How many of these have contributed to unplanned and unwanted pregnancies? And how many of these unplanned and unwanted pregnancies end up in unsafe abortions? So a resilient supply chain is a must. And then existing disaster management training curriculum, all this curriculum on disaster risk reduction should be incorporated with actions and with risk reduction strategies and climate adaptation actions on SRH and GBB. Last but not least is the national level and policy and systems level. That is about how we need to orient or sensitize, let me use the word sensitize, policymakers around this very sensitive SRH and GBB. It's not that an easily digestible subject to listen to and to come up with actions, but it's our job. And some collective efforts are required. Similarly, integrate climate disaster risk assessments into SRH and FP. Like I talked about climate adaptation or disaster risk reduction policies, but at the same time, our documents now, for instance, these days, we have started working on this Pakistan Demographic Health Survey for next 5 years. This is the right time. We need to come up with some actions and interventions to identify climate impacts on SRH and GBB. So that will become a future, like for next 5 years, a reference document for us. Early warning system should identify when and where GBB risks may rise during climate crisis. Similarly, GBB risk mitigation should be part of all initial assessment during preparedness and response, and integrate climate risk vulnerability mapping district into district and provincial level health systems and other protection support systems. Last but not least is availability of high quality data. That is critical, particularly on maternal and newborn health, for understanding the global burden of these impacts on our systems. So with this, I will conclude here. Thank you so much for your question.
Thank you, Dr. Rashid. While my team will be settling some chairs here for the panelists, we can have some comments from the audience. In the meantime, please, if we have a mic there, we would particularly love to have some feedback, some from PDMA's colleagues, but anyone that is invited for your comments. So यहाँ पे ज़रा जल्दी से करवा दीजिएगा जी हमारे chairs के लिए. There are not, I mean, in two types of presentation, there are no questions. Generally, if you don't understand anything, or you understand everything. So either this is the best of the best that our presenters have present, or you didn't get anything that we have said. So please, so we have two raise hand now. You have 3 minutes, the team sitting in the chair, 3 minutes.
Assalamu alaikum. My name is Sidra. I work at Friedrich Ebert Stiftung as a program advisor, and newly getting this role of climate change in the region. My question was, Dr. Saab, to all the authors as well, and maybe it's out of my not too much knowledge, and maybe you can correct me. I never get this one point that why we put the burden of gender-based violence on climate and not, I mean, when it comes to men and women relationship and where men are imposing violence on women, like you showed different quotations that they were being beaten more than before. I mean, is it the problem with the mental suffering or something which should be part of nation building, that men and women should grow like normal human beings rather than putting the whole burden on climate, that because the climate has changed, now men have to do more violence. I don't
Thank
get
you.
this point.
It's a big question. And I think,
And then why women don't get violent after climate change? I don't get this.
no, I think while as a macroeconomist, I don't qualify to answer this question, but 2, 3 quick things. And then Dr. Sheet also has to, but let's go then to Dr. Sheet first. Dr. Sheet, over to you. Yes, please go ahead.
The quick answer to this is like according to PDHS, Pakistan Demographic Health Survey report, like some 34% GB gender-based violence has been reported, right? 34% is a big figure. Now here, climate change, climate-related disasters, or any other humanitarian emergency, these actually multiply. These make these statistics double and triple. That's why one of the action was we need to engage men, right? And it happens with anyone, not only women, not only girls, but look at the vulnerabilities. Who is more vulnerable? That is one thing, vulnerability, the level of vulnerability. And number two, it's not that they are, but their engagement, men, and like we already suggested, if I respond to your question well, their engagement is critical. We said like overall youth role, girls, adolescent girls, boys, they all have a role. Thank you.
Thank you. Your chair team has done their good job in 3 minutes. So may I invite Dr. Gulnara, Dr. Shehzad Ali Khan, and Ms. Humaira Zia, Mufti Secretary, NSCW, to come on stage. And two of our, we have also have Tahir Ghaznavi Saab. I hope we have 6 chairs, so 2 of our speakers can also come on the stage because people will be having questions. So if you wanted to answer from there, we are okay. If you wanted to come on here, so you may join. This is bad. It's bad, please. So as our authors are hesitant to come on the stage, so let me ask Muqaddar Saab to sit with us on the stage. Muqaddar Saab, please. No, it's fine. We can invite you now from here. Muqaddar Saab, aap aa jaiye, please. There was another raise hand question before we ask special. I know Secretary Sahaba has to go, but we take more question and then please. Mic there. No, we will still ask you on the mic because we will be recording.
Okay.
Please.
Sir, so my question is directed to Dr. Rashid. I just wanted to ask about the action plan that it has all the suggested steps and everything, but what about the timeline of the action plan and where the resources will be coming from? Do you have a timeline? Like,
Well, first of all, financing, right? That is the biggest challenge, and just I'm sharing my thoughts, my understanding around that. When you have actions based on evidence, where this job of advocacy, policy level advocacy, and advocacy for funding and finances starts, particularly starting from domestic funding from within. Second is timeline. Well, it will be hard to respond to that. Usually, it's like once you have this evidence generated, it takes time, like over the years. Thank you.
Thank you. Let me now invite our special remarks on today's event. And I'll begin with Ms. Humaira Zia, Mufti Saiba. You can come with your reflections, what we have presented. But how can your organization, your department can help us take this agenda forward? So that is the one. What are the initiatives that you think are aligned with what we have been presenting? And also, how can UNFPA help you and your department to take this agenda to the implementation stage. So you can speak from there or you can come here. Your choice, please.
It's okay. I'll
Go ahead,
speak
please.
from here. I just broke my shoe, so it's okay. We are used to it. हम barefoot भी चले जाते हैं meetings में. So I've gone through the report a quick glance, and I'm so glad that the work that National Commission on Status of Women has undertaken is completely aligned already, even before the study came out. So एक मुझे थोड़ा सा I would mention that National Commission was I'm not complaining, was not engaged in the development of this report. So if we were consulted, you would have found out how intense National Commission on Status of Women has worked on the issue of climate change. Being a national security strategist and specialist, and having worked at National Security Division, and also in the area of counterterrorism and radicalization, we specifically looked at climate change as a threat multiplier. And when we are looking at the threats of the climate change and the ethnic divisions and how the intersectionality of the crisis, the marginalization, the race, the religion, and the vulnerabilities, they interact and they increase the threat in terms of not only national security, but also for the people who are at the receiving end. When your people are impacted, the citizens of Pakistan are impacted by an incidence of climate change, the non-state actors get more access to these threats and these narratives where the state is non-responsive to their needs. So when I came to Ministry of, at the National Commission on Status of Women, we specifically looked at how women who are the silent sufferers, but at the same time, they are the reservoir of resilience for Pakistan. We started looking at all the documents related to climate change. The NCSW has written reports on under the next horizon, and also our work plans where the climate change and women resilience are integrated. NDC, when we found the document NDC 25, I reviewed it personally and I saw that GBV, sexual and reproductive health, safe spaces for women, access to sanitation, wash facilities, or even safe spaces during extreme heat instances, or women-specific climate adaptation funds, or providing them seat on the table. None of these issues were part of the NDC 2025. So National Commission held a meeting with Ministry of Climate Change. We have conveyed our comprehensive amendments to the NDC 25. And I'm so glad that every word that is there in the report is there as amendment to the NDCs that Pakistan has already submitted. And we held consultation with Ministry of Climate Change and NDMA included. So when it comes to GBV, sexual and reproductive health, access to safe spaces, or even giving birth in a decent environment, including budget tagging of the NDMS and PDMS is there. So what Pakistan has done, not only that we have amended the NDC 2025, we have also reviewed the enhanced Lima Gender Action Plan. It's a very comprehensive document, but that leaves the responsibility on the member states. So when you leave the responsibility on the member states, it means you are leaving women at the discretion of any government that be in power to think whether they want to engage women or not. So what value addition that National Commission of Pakistan has done, we have proposed amendments to the enhanced Lima framework on gender action plan as not only as an annex, but we have included GBV, SRH, safe spaces for women in extreme climatic conditions, including heat. So all these amendments we are going to negotiate in COP30. Earlier, I had planned not to go because I avoid traveling too much because of my engagements. But for COP30, I specifically requested and I was included in the delegation to voice Pakistan's concern that the UNFCCC documents or even the global documents like Lima Protocol should include and must include issues that affect women so that the things are not left at the discretion of the member states. So when you don't mention GBV, when you don't mention SRH in the documents, it means they are not a priority. And when you apply for GCF, you get a gender action plan. And I was really surprised when I looked at the Pakistan's gender action plan, which was prepared in 2022 by IUCN. And under the GCF, it does not include any of the concerns that are highlighted here. So as you said that these issues are known to us, but even they didn't find in their way into the policy documents, that then means that the women on ground were not consulted. So when you don't give a seat to a woman who knows the subject, and even the rural women, the women living in the peri-urban areas, if you don't include in the discussions, as I can see from FGD, that those are the real life stories, you don't get this insight. So when policies and these documents are prepared in isolation and not through a consultative process and written by consultants, with all due apology, I have huge respect for the consultants. But when you don't engage with institutions like SDPI or BIDE for that matter, or academic institutions which are really working on ground, you get a very skewed view of the issues that are being faced by women. I have been working as a volunteer in Balochistan and KP. I'm from KP, and as a volunteer in Job, in Khuzdar, in Loralai, Ziarat, and as on different issues. And in the floods of 2022, we sent boxes of sanitary napkins. And I'll tell you how the culture prohibits provision of these supplies. So the boxes were rejected. So we were moving the convoys through the military, and we had these boxes with sanitary napkins. And the men said, this is a Western agenda, and you want to create immodesty amongst our women. So for us, it was an innocent approach to provide sanitary napkins to women who are being affected by the flash floods. Their clothes, literally the clothes that they wear, were washed away in the floods. They had nothing to wear, not even the chadar. So the men had to give chadars to the women who were just naked. So we have seen these incidents. We have gone down to the village level. I was not at NCSW. This is in 2022. I was at National School of Public Policy training civil servants. So जो point मैं बताना चाह रही हूँ कि when you are going for an intervention during the drought or for the climate resilience or adaptation, you need to know the culture, you need to know the people that you are interacting with, and you have to design your intervention in exactly the way their cultural limitations allow. We still managed to deliver the sanitary napkins and the essential kits to the women who were pregnant, but through a very socially and culturally viable mechanism and narratives. Now, I would also like to discuss the gender disaggregated data. Not many people are aware that National Commission on Status of Women has National Gender Data Portal. The work that I did was to connect our NGDP with the data maintained by NDMA. And since the PTMAs are here, I'm going to leave my card to ensure, and I'm going to hold a separate meeting, like we have done our consultations with Ministry of Climate Change, but I would request UNFPA, and I'm also in contact with Saleha, that when floods happen, underage child marriages happen. I'm going to another meeting by the Norwegian embassy where the child marriage issues are being discussed. It's a reality. 12-year-old, 9-year-old, 10-year-old girls are just given away because parents think instead of them being abducted, they are married off. So now, how do you provide that resilience to the community where the girls are not married in a haste? The parents might not be willing, but what's the option do they have? And then comes the budget lines where the budget tagging has to happen before even the flood comes. You need to know the number. You need to create a vulnerability index district wise. Did anybody thought that Bunair would have such a massive flash flood that would take away the lives and their livelihood? And the third one, the first pillar is about the gender tagging. The second is the data, and our fourth pillar is gender responsive adaptation and use of AI in early warning system. So what NCSW has done, we have held intensive meetings with NDMA to issue hyper-localized, easy to understand early warning systems of disaster, of impending disaster or advanced warning system through lady health workers. They are there, they have the smartphones. So we are designing a program. I would request UNFPA to help not only to map gender-based violence, it should be on the tips of the women, lady health workers, the polio workers, the vaccinators, the women, and the BISP beneficiary committees. I'm glad I was at BISP and I created this BISP beneficiary committees where local community women can get together, provide the basic information to the women. And you all agree the women network works faster than the men network. So if you use the women health workers who already have a trust level in the community or the Benazir beneficiary committees, BBCs as we call them, you can not only inform them about the disaster that is going to come, but also where to go. What are the safe spaces? The provincial authorities, the PDMA must create the vulnerability index of the region and then identify safe spaces. I'm also on the advisory committee of PIDE, and recently a GLOF report is being prepared. The safe spaces identified were never created. Millions of dollars were being spent. So now an accountability of the GLOF spending is being carried out. Where are those safe spaces? If there is heat, women are affected differently when it's heat, extreme heat. I have hyperthyroidism. It just kills me when temperature goes above a certain level. Imagine a pregnant woman asked to tend for the animals, go and work in the agriculture, pick the cotton crop. What is her condition? And I think these are the invisible women. The policy is not even counting them. The women in the informal sector are not counted, even in the agriculture. So these are serious issues that NCSW is looking at. And I would request that as a follow-up, we need to have a bigger consultation between the PDMAs and NCSW as a major stakeholder, Ministry of Climate Change, where we look at our policy shortcomings. And also on the data. We are now making National Gender Data Portal as an observatory. That observatory is going to issue scorecards and reports as monitoring reports on the performance of the PDMAs, NDMAs, Ministry of Climate Change and all. Have they tagged budget? Have they identified spaces? So this is the accountability mechanism that we are putting in place. Thank you.
Thank you, Madam Secretary. Before I invite Dr. Shehzad, any questions, comments from the audience? So we have one comment here. If you can bring mic. I'll also be coming to all the PDMAs for the comments. So please, you can take your notes.
So just one more point.
Yes.
We didn't stop at NDC and Lima. We are also working on the land degradation. We have also drafted Prime Minister's sectoral plan
Excellent.
as part of EU GSP. And exactly these points are part of the Prime Minister's sectoral plan, which will be visible to the Prime Minister himself on his dashboard, whether all the agencies are delivering when it comes to issues affecting women. Thank you.
Thank you. So we'll take comment from here and then from there. And then we will invite Mike Araj. Then we will be inviting Dr. Shehzad, and after that we will come to
Thank you
one by
very
one to all
much.
PDMs.
This is Dr. Masuma Zedi from KFW, the German Development Bank. First of all, definitely UNFP, an excellent work done, commendable research. It is required. But then I would really second what Madam just said, that in silos, I still believe lots are also there, you know. It's still being done. We have, for instance, we have substantial amount of support to Benazir Income Support Program, where under BISP, we ourselves through OPM have conducted various researches, including topics which were just kind of, shared. So I would also kind of urge that please also, when you're doing all these consultations, involve what Madam said. Also, there's this big INGAD group of UN women that is so active and always inviting us. So that is also one area. When we talk about data, for instance, there is huge, very well established data mechanisms, for instance, under BISP, also under Punjab, and now his do big program in KP. So I'm just giving you a few examples. There a lot still is there. We just need to kind of, see where the synergies are, consult more. And then if I do understand not everybody could be here, but then, please, the urge would be that your nice findings at least should be shared with the pertinent stakeholders working in the same area, because climate change is big time, cross-cutting. Whoever we now meet, be it from policy till the grassroots, everybody is involved somehow in the climate who is even affected. I can tell you number of programs that we do is completely with not even just with the public sector, also with the private sector. Big engagements are there where there are no facilities. For instance, 3 to 4 kilometers, there is nothing. There is Green Star, there is DKT, and many other NGOs, who are doing lots of things focusing on women and, these topics. So please do include everybody. And of course, please share these reports with her. But excellent work done. Thank you very much.
Thank you. Thank you. We'll taking notes. And ma'am, 3 points I think which really have been very important, and I'm sure our colleagues from UNFPA will be, as you suggested, follow-ups. I think NDCs remain the most critical point, and that has one word that has been used by Dr. Rashid most when we were developing the action plan. So I think this will be good that if your commission can sit with UNFPA, that how you can take these messages to integrate to NDCs.
We have already done that, and I will share our comments. I've already shared our comments with Soleha that we have submitted for NDC. I see Dr. Saab sitting over there. He was part of our consultations. हमने तो यहाँ तक कहा कि NDC revised NDC फटोफट upload कर दें, because we have serious concerns and we have conveyed them at the appropriate level. Second thing, IOM is running a consortium, so we recently called them. You are absolutely right. Everything is in isolation. From the national security consultation, then you see Dr. Aisha somewhere, then you see one person. So NCSW is willing to host across sectoral, across provinces, because we have a mechanism of IPMG, interprovincial ministerial group, where the CMs and the CSs all come together. Since it's gender, and I'm the lead for COP30 on gender, so we can have a very big gathering of anybody or who's anybody, be it the financier from ADB to World Bank. We just received one fine Twitter message that ADB has allocated $250 million on climate resilience and all. So I'm immediately saying, where is this money going?
Yes.
Then I went to EAD and I asked them, I'm very critical, by the way, on these aspects. A lot of money is being spent tracking where is it going? Is there duplication? I even suggested to the Prime Minister's office that even the BIS payment or the social safety nets at the provincial level who are going, make sure that the money is not going to the same person for the last 12 years, create heat maps where the vulnerability exists. So you need a vulnerability index first, which you don't have, and where intersectionality I've noted down on the points of intersectionality where the gender, race, class, religion, persons with disability exist. So where you go in a very hyper localized manner so that you don't waste resources. IOM, by the way, consortium, their approach is very targeted, and I really like their approach. But that lesson needs to be shared across the board.
Thank you, ma'am. I think the second option that is much near is the COP. I'm sure Dr. Rashid and UNFP and all us there, we can develop you some messages that you can take from this study to COP when you are traveling. So we'll be following up with you. It can be a policy brief. It can be
If the case is approved by the competent authority.
Yeah, that we leave.
Because the cost is huge for participation. We
Yes.
have to fund ourselves. By the way, we National Commission also launched Ek Beti Ek Shajar campaign. A tree for every daughter. It's for honoring girl child. And similarly, you would not want to cut a fruit tree in the middle, like when it's growing and about to fruit. That's the message we are taking to COP, that underage child marriage means you cut the tree when it's about to give fruit. So let them grow, let them give the shade, and they are the voices. So we are about to release a song as well, a very sweet song on respecting women, and you'll
Thank
be
you.
seeing it soon.
Thank you. And my team, please give me an email or letter that you had sent to the commission and others. That is the only safe way. Otherwise, it's criminal if you have missed engaging commission in these consultations. We have to be more inclusive on this one. With this, let me invite Dr. Shehzad Ali Khan, Vice Chancellor, Health Service Academy. Sir, your comments, you are preparing the people, those who take the message at the academy. And I think this is the most critical juncture to sort of deep root these messages in terms of SRH, in terms of family planning, in terms of preparing health workers, those who are working in the disasters. So how you take this messages? The question is again same. How does this align to your work, and how can we help to take these messages more forward and nurture into the trainings when you are preparing the health staff? So over to you, but you can have any other reflections as well. So please. Yes, please.
I think I'm a teacher. It's very difficult for me to talk while sitting. So thank you very much, Sajid Amin Saab. And whenever I, join any panel discussion or any event at SDPI, I'm really impressed not only by the quality, and UNFPA. UNFPA is our partner implementing. We are the implementing partner of UNFPA as well. We have been working with UNFPA quite for some time. Immense, knowledge gain and of course a lot of service delivery. Today's discussion, if you see, excellent work done, nice presentation, and Rashid and Amir Saab both utilize very less time to tell us a lot of things. Ms. Homera, Honorable Secretary Sahib, she also added a lot of new comments as well as food for thought for taking up in the implementation stage. There are two different things like joined together here. When you talk about women and girls, it's already a vulnerable group. We consider women and girls as marginalized, as vulnerable in most of the developing countries. And without even disaster, in normal days, a woman in a developing country is passing through a crisis every day. For a woman, every day survival is the key. They survive the day and they pass the night just to stay alive. And the next day thought is never there. in them, most of them. And I'm not talking about the women in this city or within the boundary of Islamabad. I'm talking about the women she talked about in the peripheral areas and rural areas. So they are already in crisis, in disaster, through various setbacks and other things and inhibitions of a lot of things. Just to give you a little bit of magnitude of the problem which Pakistan has when it comes to the core function of UNFPA, and we are good to have the deputy representative of UNFPA over here. Every year there are around 12.7 pregnancies. The women are passing through 1 crore 27 lakh pregnancies. Out of those 1 crore 27 lakh pregnancies, 60 lakh, 6 million are unintended. Now, 12.7 million pregnancies, 6 million unintended. So some of them, they try to get an abortion. So there are some, you can say, tried abortions of around 38 lakh, 3.8 million, 38 lakh women go through a sort of a trial for abortion. And there are huge number of deaths due to this. 1.5 million unintended pregnancies reach to the term, so they deliver. So 15 lakh newborns born in this country every year are unintended. So they are a problem for the women who produced and the newborn itself, specifically if it's a girl, and also for the whole family. So just imagine the problem. 1 crore 27 lakh, 60 lakh unintended, 38 lakh tried abortion, 15 lakh reached to the pregnancy, 7 lakh miscarriages and stillbirths. And that makes the Pakistan #1 country, sir, in the world for the highest newborn mortality rate in the world. We are #1 newborn mortality country in the world. Much worse than Lesotho, Congo, Zaire, Afghanistan, and the countries with $500 per capita income. We are worse than that. So, and all this narration which I told, the suffering is the women, of course, and the girl child which is coming. Coming to that next level, which is the climate change. So there is a problem of a lot of survival. The life of a woman is very difficult, and the reproductive health scenario I already showed to you. They just deliver a child, and within 1 year there is another pregnancy coming up. Repeated pregnancies are very common. The TFR is very high. The household size is around 6.7. It's much higher, and we have, I think, 65% of our population is less than 30 years of age. It's a dividend. It's a youth bulge, but we are not using it because they are unemployed, they are untrained, and they don't know what to do. So, and we are, and they are always trying to do something because they have a kick, they have a hormone insurgence. So it's very difficult to manage them. So this is a big problem when it comes to women and girls. The next problem is climate change. It's not about floods only. Yes, you did this survey in floods, but we have, the PDMA knows it, the NDMA knows it, the Pakistan is multi-hazard vulnerability risk. It is MHVR, and we did an analysis. I have been working with NDMA for last 10 years, and I will share, madam, with you as well. In 2020, with General Asghar, we developed a document of needs and I'll share it with you as well, needs and concern of women and children, and we added disabled. Women and children and disabled in disasters. So NDMA developed that. There is a GCC, Gender and Child Cell. Tanya was there in the GCC in NDMA. So we developed that report. It was also a national level report. And the findings were similar. The problem is that we are not the contributor of this disaster, climate change. Pakistan has no contribution in the global climate change or, global warming. We have very limited. You know how much industry we have and how much fossil fuel we burn. It's much less than what they did 50 years ago, the developed countries and of course the other big countries. So our contribution is minimal. And on the other side, we cannot do much to stop that as well. So this understanding should be very clear. It's very difficult for us to manage whatever is happening. We have a very small role when it comes to global climate change. It's the developed countries who are responsible, and they will be doing something big, say big costly things to prevent that. Only thing which we can do is the adaptation. the disaster risk reduction, and the protection of women and children and disabled, and of course the communities. So the community-based disaster risk reduction, which is the very important thing for us, I think that is what recommended by Rashid here as well. So what can we do? Just maybe 2-3 minutes more. What can we do is, it's very difficult for an outsider to reach the disaster area, specifically in floods and earthquake. So outside help is not available. So what is the solution? The solution is helping within. So what we can do is, like you mentioned, the community health worker. I'm working with the Balochistan government. Secretary Health is working with Health Services Academy. We are a partner in development with Balochistan. We have around 200 plus students currently stationed in HSA for various skill-based trainings. And majority of the students in HSA currently are over 60% are female. So we have enabled the female of the rural areas in different programs of HSA, nursing, midwifery, and of course allied health. So we are working with them. There is a thought that we should be replacing this lady health worker, because the lady health worker thing has gone to a dying cadre. Most of the governments are not trying to support them because they have become the permanent government employees, and they have become in fact a liability in many forms, the pension and other things. And also the work being done through them is not of that quality which was there when they were a volunteer. So UNFPA, HSA, NCSW, all of us should sit together for this women and girls. And when you talk about training and capacity building, and like you asked, what can the HSA do? We are a national level institute. We have an outreach of the whole Pakistan, including the merged districts as well as the states of GB and AJK and the provinces, and of course Islamabad. What we can do is we can train a volunteer-based groups of youth. Okay, so I am working with the PM Youth Program, Rana Mashood Saab, and I'm working with him as well to mobilize this youth bulge into something which is life skill based education, which is technical education, and which is utilizing them within the community, within the union council and within the village. So what we can do is we can create a volunteer, not paid cadre of a health workforce, which is paid, and not just health workforce, environment, gender, and of course health means emergency response. So we can train the community health worker in first aid, in life skills like resuscitation or something like that. So 2-3 months they will be very good to provide emergency in the flood and otherwise. So sustainability of within the community and availability of a worker, not a health worker, of a social worker inside the communities, which has life skill based education, which has some health education, which has some gender responsive or gender sensitized services. They are trained, so they will ensure it. So you don't need to bring something from outside. The inside help should be there. And then within that, we should be able to develop something which is domestic supplies of those things which you mentioned in the peacetime. So in the peacetime, you should have enough reproductive health commodities. You have enough supplies for like safe hygiene, menstrual hygiene, and other things. They should be available inside. And so in the normal time, we should train them, we should equip them, and the supplies should be there. And if they don't need to travel within that crisis, they will be the biggest help. You know what happened in COVID? The facility-based services were almost stopped. The MNCA services went to zero because we asked everyone, and I was in NCOC, and I was asking everyone not to go to a hospital because anyone who goes to a hospital would get COVID. So we asked the pregnant women and others not to go to hospital. So almost it ceased for almost a year. But we found out that the community support, wherever it was available in the form of a civil society or an NGO or a voluntary worker, they were the one who responded to that crisis. The GPs were there, so we can use GPs, female GPs specifically, and LHVs. So there are LSWs, there are LHVs, there are community midwives, and there are some other outreach workers already stationed inside the village. NCSW, UNFPA, HSA should use them, make them life skill based, trainers, master trainers. So use them which are already there, make them life skill based educators and master trainers so they can train the others. And like in the army, I also train the Army Medical Corps, and we have a buddy care program. There is a buddy care program. Every soldier trains the other soldier in life skills. So we can have a trickle down effect down the road. I am here I am very much, open to this idea. HSA will definitely be volunteering for this kind of training. If you develop anything like that, they can come up with a gender responsive or gender sensitive curriculum. UNFP already has international experience. HSA already has majority of the girls coming all over from Pakistan and studying in various technical and vocational and other programs of public health and others. And we can create a small, maybe 1 month or 2 months training, which should be there in the divisional headquarters. In this country, the government buildings are enough, number one. So you have enough buildings, but nothing is happening in there. When I talked to Mujib Sahab is the Secretary Health Balochistan, I talked to him. He said, you just name the divisional headquarter. Within the divisional headquarter, there will be a divisional health development center or a district health development center, fully equipped, but useless. So we will bring those people over here on a daily basis. They will get training and they will go back. It's a very least cost method, very least costly. And we will be openly, asking for collaboration with all the other development partners. We are a partner to UN Women as well. We are having some of the gender sensitive, and Rashid knows it. He started 10 years ago, I think, in HSA, MISP. The minimum intervention service package, the HSA is one of the main, institution who trains on MISP, and the MISP trainers are available with us. So that is one which UNFPA always recommends in case of disasters. We will be having that, but the presence of a qualified life skill based educator or a social worker with very good knowledge of resuscitation, delivery, and other things, first aid in this community will be very much okay. Last point, आप में से किसी ने पूछा था रशीद ने सही जवाब नहीं दिया कि मर्दों का और औरतों का, वो सवाल जरा रिपीट करेंगी? There was a question कि जी domestic violence में जी आप जरा सवाल पूछें. 2 minutes सर बस जी. हाँ, मर्द क्या होते हैं?
सवाल एक्चुअली ये था कि why are you putting burden on climate change?
हाँ, अच्छा जी. अभी एक चीज, मैं 20 साल से मैं इसमें भी काम कर रहा हूँ, जेंडर में भी. तारा अब्दुल्ला के साथ भी मेरी बड़ी लड़ाइयाँ हुई हैं और सनिया निस्तर के साथ में होता था, हर बहस में लड़ाई होती थी. एक चीज आप जरा क्लैरिफाई कर लें सारे आपस में. डिमोनाइजिंग मेन in cases of bad things happening to girls or women is not, I think, suitable. It's not ideal. It's not true. जब भी आप जरा देखें, आपने अगर सुना हो ना, गुजर खान में एक खावंद ने अपनी बीवी को तेल डालकर छिड़क कर घर में आग लगा दी, तो थोड़ा सा डिटेल में जाएं, उसकी एथनोग्राफी करें उसकी. एक मर्द था, 4 औरतें भी थी जिन्होंने उसको पकड़ा हुआ था. एक ने पेट्रोल लेके आई थी, एक माचिस की तीली लेके आई थी, और 2 ने उसको पकड़ा हुआ, दरानी जिठानी ने. तो वहां पे 4 खवातीन थी, एक मर्द था जिसने आग लगाई. सबसे बड़ी दुश्मन औरत की, एक बात याद रखो, वो औरत है. सबसे बड़ी दुश्मन औरत की औरत है. हमने औरतों को एम्पावरमेंट की बड़ी चीज सिखाई. हमारी उन्हीं औरतों ने जिन्होंने और लड़कियों को एम्पावरमेंट, गर्ल एम्पावरमेंट की बात की, वो अपनी पूरी बेटों की जनरेशन को औरत की इज्जत करना नहीं सिखा सकी. बदकिस्मती ये भी है. तो हमने अपने बच्चों को औरत की इज्जत करना सिखाना है. वही खवातीन मेरे साथ जो एक्टिविस्ट हैं, हम खुद फेमिनिस्ट और जेंडर एक्टिविस्ट हैं, हम जब जाते हैं बात करते हैं तो हम कहते हैं आप लड़की को तो बड़ा अच्छा, सब कुछ लड़की करे. ये अजीब बात है ना कि एम्पावरमेंट भी लड़की करनी है, खड़ा भी उसने होना है, लड़ाई भी उसने लड़नी है. और भाई आप अपने बच्चों को, मेल्स को भी तो समझाओ ना, अपने खावंद को, अपने भाई को, उनको भी समझाओ कि वो ना हाथ उठाएं और ना ये वायलेंस करें. सो द मोस्ट इंपॉर्टेंट थिंग इज वी शुड नॉट डिमोनाइज. 10% लोग ऐसे हैं, 10% मैं कहूँगा ऐसे हैं जो इंतहाई, मतलब मेरे ख्याल में उनको संसार कर देना चाहिए. जितनी जुल्म वो करते हैं औरतों के ऊपर, उनकी सज़ा सबसे बड़ी है जिसने जुल्म किया. लेकिन बहुत सारे ऐसे हैं जो अपनी बीवी को, बेटी को, बहन को इतनी ज़्यादा इज्जत और रेस्पेक्ट और इतनी ज़्यादा फेवर देते हैं. आज आप सब जो यहाँ बैठे हैं, आप खुद सोचेंगी कि आपके वालदेन का, आपकी वालदा का, वालिद का, हम सब में, हमारी माओं का, बहनों का कितना बड़ा कंट्रीब्यूशन है आपको यहाँ पहुँचाने में. सो आपका जो एक हमारा ये जो डिमोनाइजिंग वाला मसला होता है ना, इसमें पता है प्रॉब्लम क्या होता है? इसमें ये होता है कि फिर एक टैबू लग जाता है, स्टिग्मा हो जाता है, फिर मर्द भागते हैं ऐसी मीटिंग्स से. तो ये उन्होंने बिल्कुल सही कहा, इन्वॉल्विंग मैन इन फैमिली प्लानिंग, या उसमें सबसे बड़ी जो डिसीजन मेकर है ना आपकी फैमिली प्लानिंग की, वो मदर इन लॉ है, या लड़की की माँ या लड़के की माँ. ये हमने सर्वे से प्रूव किया हुआ है. द सर्वे प्रूव दैट द बिगेस्ट रेजिस्टेंस टू द फैमिली प्लानिंग यूज इज नॉट द हस्बैंड, इट्स द मदर इन लॉ. इट इज द मदर ऑफ द गर्ल. और कि जी वो एक बेटा जरूर करके देना है तूने, बेटे के चक्कर में 4 बेटियां तो आगे 1 बेटा करके देना, 5 बच्चे पैदा कर। तो ये चीज़ें हैं, ये सारी कल्चरली हमारी ठीक हो सकती हैं जब हम सारे बैठें। और इसमें एक और मैडम, मैं सेक्रेटरी रिलीजियस अफेयर इज़ वेरी क्लोज फ्रेंड ऑफ माइन ताउर रहमान साहब, उनके साथ भी हमने बात की कि ये रिलीजियस मसला भी नहीं है, इट्स अ कल्चरल इशू। अमर्ता सेन की आप किताब पढ़ें, अमर्ता सेन की जो किताब है जिसमें पावर की बात की है, इट्स द पावर डायनामिक्स। माँ कभी नहीं चाहती कि मेरे बेटे की जो कंट्रोल मेरा है ना वो उसकी बीवी ले ले। तो वो जब आती है ना, तो वो जब वो खावन शाम को घर आता है ना थका टूटा बेरोजगारी करके, वो कहती है ये दूध वाले से गप्पे लगा रही थी, ये सब्जी वाले से गप्पे लगाती है, ये फलानी जगह जाती है, समथिंग लाइक दिस। तो ये चीज़ें हमने ख़त्म करनी है मिल के। तो आपने ये सेग्रीगेशन नहीं करनी। जेंडर इज अ सोशल कंस्ट्रक्ट, जेंडर इज नॉट मैन वर्सेस वुमेन। जब आप मैन वुमेन कहते हैं जेंडर गया, जेंडर खत्म हो गया। जेंडर के लिए आपने ये नहीं करना। सो मे बी व्हेन वी टॉक अबाउट दिस वी शुड टॉक अबाउट द ट्रू स्टोरीज के जिसके अंदर किस तरीके से ये हुआ है। बाकी एचएसए का मैं आपको बता रहा हूँ, एसडीपीआई के लिए भी, यूएनएफपीए के लिए, एनसीडब्ल्यू के लिए, वी आर अवेलेबल। यू कैन यूज द फोरम, यू कैन यूज अवर डेवलपमेंट पार्टनर्स, वट एवर फंडिंग इज देयर फॉर going or maybe implementing the recommendations which were given by this very good assessment and exercise. Thank you very much.
Thank you, Dr. Shehzad. I think one thing, just to add, those women who operate, they operate through men. Let's remember, if the mother-in-law is powerful, she is because of the son and the husband. So let's not sort of try to put burden there back. The issue is critical, and we need to understand this from a power dynamics. Muqaddar Shah Sahab is thinking some study on power dynamics. What is the power dynamics between the male and the females in Pakistan, men and the women in Pakistan? That is what shapes. My mother is powerful on my wife because I am powerful on my wife. If I am not, वो जहां जरा शोहर कमजोर होते हैं सासें कुछ नहीं कर पाती, ठीक है ना? So we have to understand that power dynamics because that is where the challenge is. But I think the good point is that the curriculum part, I think, was very important. Two very important points made by you, Dr. Saab. The one is creating a chain of trainings for the wider impact, volunteers. And the Prime Minister's Office that you are working with, UNFP is also working with the Prime Minister's Office on a Youth Development Index. Pakistan's the first Youth Development Index that UNFPA is leading, working with Prime Minister's Office. I think there can be co-synergies. Yes, second. The first was the pilot one, I think. That is a larger scale. But we take it second, this one. So let me now have a comment from PDMAs, and then I'll coming also to Dr. Araf Gohir, to you as well. You are leading one of the most scientifically good organization in Pakistan working on climate change. So I'll be coming to you. But our colleagues from PDMAs, if we can have Mike Aksa, to colleagues from PDMAs, and we continue to have messages that member has left, member is leaving from NDMA, but we haven't still received. Exactly. So please, your comments.
Assalamu alaikum. This is Asghar Ali Jamali, and I'm serving as Deputy Director Rescue and Monitoring and Evolution in PDMA Balochistan. So some of the points or the action has been taken by the PDMA for the gender inclusive cell and the gender empowerment. That want to talk about that, and then then I have a comment or the questions from you people for my guidance. So recently we have established the gender-based violence and child GCC cell in the PDMA Balochistan with the support of the UNFPA. And we have also established the GBV plan and the policies and the frameworks. And in flood 2022, we established the women and child family health services over there, where we have provided the psychosocial supports to the affectees, as well as we have established the 1089, the free helpline with the support of the Women Development Department in Balochistan for any harassment cases being reported over there. And then we have also now recently we have signed the MOU Memorandum of Understanding with the Rehnuma Family Planning Association of the Pakistan in order to inclusion of the SRH services into all the contingency planning in Balochistan. And we have also working with the Islamic Relief of Pakistan in order to get the technical supports for integration of the GBV and the NGCC's the matters inclusions or aligning with the PC1 documents and in all projects. As well as we are working with the health and the population departments for inclusion of the SRH services into their planning and the policy matters. But one thing which is pinching me which I have heard from all the participants and that is the issues in Balochistan especially. There are the how we can remove the cultures and the social norms influences women ability to participate in the climate actions, and then as well as that the very difficult part is that the inclusion or the engagement of the female or the woman into the policy and the decision making in Balochistan, because we are living in the very tribal areas where girls or if we say that the literacy rate that is below the 32% in the Balochistan, and then that is very much difficult to engage them into the policy making, into the decisions. So need your guidance, please.
Thank you. We will have all comments first, and then in the last, we will be coming to 1.5 minutes for each speaker. So you can pick any questions from the PDMAs that is coming there. So next we have comment. Thank you.
Assalamu alaikum. Arif Khan, Deputy Director, PDMA KP. First of all, thank you so much for organizing such an important event as it's a burning issue and climate change. PDMA KP, you all know that recent flood affected especially the 7 districts in KP: Buner, District Batagram, Shangla, Swat, Swabi. We are also engaging our human resources as well as our equipments, manpower there. And provincial government also announced the additional deputy commissioner offices as a monitoring cell. And we also installed different, with the collaboration of different semi-government organizations, the camps in which these affectees are thoroughly examined. They are stayed there and also provide them the facilities. We also have a GCC cell, Gender Child Cell in PDMA, with the collaboration of different non-government organizations and government organizations. We are providing different workshops in university level, in different communities, remote areas. So as far as this event is concerned, it's very important to be here with the stakeholders, and inshallah we will see in future as well the events in Peshawar, especially in KP, in the remote areas and all over the Pakistan. Once again, I am thankful to be here and in such an important event organized by you.
Thank you. We are thankful to you as well joining, but I think we will be even more thankful if in follow-up you can engage with UNFPA and that how can
yes,
study
I'm thankful to UNFPA as well. Thank you so much.
So we'll see the follow-ups. So next, please, Aksa.
Hi, my name is Kalim. I'm from PDMSN. So it's a very good topic to you hear me. But at the time of the floods and the droughts, we secured the affected people from the affected areas. But now we are working on this topic in future. We have a different, we have a warehouses. We have a different kind of things to secure the person and rescues. But at this time, I'm saw the climate change, and this situation, we make a disaster risk reduction cell in our PDMA and further moderate it in future.
Thank you. Thank you. I'll strongly urge our PDMA colleagues that if we can engage them, regional UNFPAs of all provinces, and we will really, I mean, it will be good if you can arrange a discussion around these studies, these findings within your offices as well. Our colleagues from UNFPA regional can reach to, we will be connecting, my team, Aksa and Umar will be connecting to you with the regional UNFPA colleagues. Any other comment? We have there a comment. Punjab is missing. I mean, they have arrived here, but they are not in the room at this point of time, as usual. Yeah. I mean, they arrived yesterday, I think, but maybe not. Aksa, am I right?
Ji, Assalamualaikum. My name is Muhammad Farhan. I am Deputy Director Agriculture, working on Energy Efficiency and Conservation Authority, NICA. Sir, as agriculture is my domain, I am working on climate smart agriculture. The mandate of my theme, my idea is use less, grow more. Even this forum is not for agriculture, but the first session, Drought and Deluge, where come agriculture comes there. So we have an idea, we can provide skills, household women's, they can grow vegetables on a very small area with a lot of production. So hydroponics is the techniques. We use water instead of soil to grow the vegetables. We have prepared a model at my office. If someone is interested, we can visit. And we can spread this model to the cottage industry. Every woman, every girl at home can grow this vegetable without a very laborious work. No laborious work is required for manipulation of soil or other operations. You just have 3 to 4 pipes. Even your drainage pipe can be used. And you can grow the salad and tomato around the year for your kitchen consumption as well.
We are already eating so much where the vegetables are grown by the drainages. So don't make us eat drainages.
Actually, this is not drainage, just drainage pipe, plastic.
On a lighter note, yes, please.
We have assembled a local model for it, where that is very cost effective.
Yes.
And
Thank you.
thank you.
Thank you. Point very well taken. And my point, I'm not a gender specialist, but from a macroeconomics perspective, I think we need to train our women in the decent jobs, more productive jobs. We have already put them so much into vegetables all the day preparing, but we will just. So let me go to Dr. Arif Gohir for his comments. Executive Director, Global Climate Change Impact Studies, a long friend, hard to catch these days because of the government engagements. So Arif, if you can help us understand the work that UNFPA is doing, and you do the impact studies, the climate change impact studies. Is there any discussion on these impacts of climate change? And if no, how we can integrate into that? If yes, how we can deepen that further under your leadership? So over to you.
Thank you. Am I audible, please? Yeah. Thank you very much for inviting me to this event, and thanks to UNFPA especially. And I still remember, perhaps it was in June, when we met on the margins of an event at NDMA where Dr. Rashid presented his study. And it was, at the time, was in process, I think. The work UNFPA is doing is a wonderful job, I must commend. And thanks to SDPI for joining hands on this endeavor. And I still remember Dr. Sajid, my friend's calls when I was deadly busy in the preparation of the NDCs, and I could not devote time for having a meeting. And I'm also thankful to Ms. Somera. We met 2 times, and we have a very, very good discussion. The point I want to make here is, it's fortunate or unfortunate, in whichever endeavor my ministry or the government wants to put me into, it is sort of a task that is disorganized. I don't know what's the reason. For the last couple of years, almost a decade, When there was no greenhouse gas inventory, I was assigned the task of preparation of the greenhouse gas inventory. When UNFCCC submissions were delayed by a decade, I was put into that, and now NDC sort of stuff we are working with. And when we go into the nitty-gritties of these things, then some issues come on the surface. The one that is presently before us. On gender issue, I am still not clear which is the one organization with whom I am to talk with. While developing the NDC, I considered number of organizations, have meeting with them and all that. But now I've found NCSW, and I will request the Madam Secretary to please hold this canvas so that there's a lot of work going on, and I was taking notes from the PDMAs. They have the gender cells in their organizations. The UN Women is doing work, NDMA is doing a lot, but where this all work is assembled, you can say, at one place. So the idea of having a portal, digital portal, is very convincing, and I would request to you, ma'am, to take hold of this so that in future when we will be developing such sort of documents, so this could be handy for us to include all the possible information that we can. Again, appreciating the word of UNFPA. Unfortunately, at GCISC or in the climate domain, we do work on the climate change impacts and risk assessments. But the level of granularity that I am seeing here, it should be reflected in the work of the GCISC, and GCISC alone can't do this work. Impact assessments, especially with the lens of the gender and under the climate extremes, we every day are living in a sort of extreme events, whether it is smog, whether it is drought, whether it is floods, everything inflict upon us as a calamity. So under these conditions, how and which one are the safe spaces for our women, for our girls? Unfortunately, there is very, very less work in Pakistan on this. But the need of our is that this work should be done. I'm not clear because I am not a gender specialist. I am a climate impact modeler. Whether any sort of climate impact modeling can assist you in your work. If so, GCISC is ready to provide that support in terms of even at the resolution of 1 by 1 kilometer, where the temperatures are rising, where the precipitation patterns are changing. If this sort of modeling is required, we are here to help you. In terms of impacts on health, in terms of impacts on agriculture, impacts on water, again, if there is hydrological modeling or climate risk assessments in agriculture, sort of things can supplement the work that Dr. Rashid and his organization is doing, and even SDPI is doing, then again, we are available. But the core message is we have to touch this level of granularity now. Simply saying climate change is there, it is impacting us, and everyone is impacted is not enough. We should be having detailed impact assessments horizontally across sectors and vertically across tiers of governance, across tiers of gender, across tiers of institutions. So this is the thing. I don't know who will hold this canvas, whether GCISC can be of any support in this. So my support is available for you people in all these endeavors.
Thank you, Dr. Arif. I'm sure Dr. Rashid will be following more on it. So ladies and gentlemen, with this, let me have last comments. 1 minute. If our speaker has authors, sorry, we are run out of questions now, time. We can have lunch. So Dr. Rashid, if you have any last comment, great. You are giving an help. Dr. Rafi, any last comment? Great, you are a big help. So I'll go from this introduction, but less than 60 seconds.
Last comment is integration. Don't, like he mentioned, integrate all the responses vertically, segregated, combine them, and under NCSW or UNFPA, or of course the Ministry of at the climate change level, integrate all the efforts together so that we have a bigger impact.
Thank you, Dr. Gulnara. If you
I think this meeting is quite a great induction for me. As a newcomer, I truly enjoy this conversation, and I see there is a common stand and understanding about the impact of climate change. I think I need to reflect a bit from my experience, not long one. I'm 26 with UNFPA, 26 years. I used to work in all regions except Latin America. And let me say, even starting from my latest assignments in Zimbabwe, the climate change on women and girls is really quite huge there as well. Drought. Girls, they don't attend the schools because of their period. They cannot afford the hygiene. So it's about poverty. It's about education. They being actually sexually abused on the way to take water. It's very different. Now coming from Sudan with a huge civil war, where the huge displacement of population, and there is a massive rape of women and girls that has a quite tremendous impact on as a national trauma. But also a part of it, they're exposed to GBV, but when you see these girls who are covered by black synthetic dresses, 10 years old, under the severe heat with lack access to water, and when we talk about dignified services, about hygiene, about water, about even to get some food or to services, it's really quite traumatic. I have all the experiences, but let me just reflect on your discussion. I absolutely agree with you. Because climate impact, it's obvious. So it's how we can build on existing systems and structures that we can really mitigate this impact, or we can adapt to the climate change. And I agree with to use all the networks, but I want to reflect on from Balochistan on the traditional norms. Absolutely, yes. That's absolutely one of the impeding factors that doesn't allow even women, girls to have access because of so-called traditional norms and practices. We need to work with the youth-led organizations. We need to work with the women-led organizations, with the powerful champions to change this pattern, because it's about our daughters, our sisters, our niece. So I think it really requires this presence. But we need to work with the religious leaders, because we have very good experience working with the Ali Azhar University in Cairo. UNFPA developed very strong partnership where it's used as a theological school, even to discuss family planning in the legacy of Islam. There is a huge department that train. They say you need to make your family planning. And when you have so many kids and repeated poverty, and kids are dying because mom, teenage pregnancy, child's marriage, or mom is not really prepared for this pregnancy. So it's really required our collective action. And we talk about education, everything. We are working as a UN together. How? Because there is so many angles that really requires multi-sectoral response. I thank you very much for this beautiful discussion. I truly enjoyed it. Thank you.
Thank you, Ms. Secretary, to you.
Thank you. I'm so glad that Gulnara has such a diverse experience, and particularly coming from Sudan and seeing the split society and the use of religion, not in terms of genocide, but using rape as a form of violence to silence communities and women specifically. I would suggest that we have still not harnessed technology. We have still not made use of social media in changing the mindset of the people, specifically referring to Balochistan, and the digital and financial inclusion of women. And NCSW is chair of the working group on digital inclusion, where we are looking at the access to mobile for women. Because whenever you want to make any intervention, be it in health or climate resilience or climate change related farming techniques that you just mentioned, how this information is available to a woman living in a far-flung area in Balochistan, for example. While I was studying in King's College London, I presented a model on access to health facilities in the difficult area affected by conflict. And I was looking at Balochistan and Afghanistan specifically, and the refugees. So we came up with a solution, and it is an award-winning solution, digital solution, which can work during disasters as well. So it's an app, and where the digital access to health is available to women in their own language and through the existing mechanisms, including Madaris. I've worked very closely with Madaris. I follow Sufi order, so I have access because of that, the Naqshbandi, which is very strong in Balochistan. So you'll be surprised, in the Prime Minister's campaign on plantation of trees, the female Madaris came out for the first time. 73,000 trees were planted by women across Pakistan, the female madrasa students. So NCSW is working very closely with Madaris when it comes to climate change, changing the narratives of honor, keeping your dignity and your values intact without creating a seismic shift because of the cultural sensitivity. So we are moving very slow. But with the technology, you can really make an impact. Coming back to the question, and I will take your visiting card, because we are working on zero expense, training the women to grow the food in your own backyard. It has worked in Ethiopia. It has changed the hydrological cycle of Ethiopia. They have planted 52 billion trees in a year. हम 1 billion trees tsunami लेके बैठे हैं. 52 billion trees were planted in Ethiopia. I went to Ethiopia and I was surprised at the transformation. Amazing transformation. Women leading the climate resilience, adaptation, mitigation, transformation. So women are your reservoir of resilience. By the way, we can use your service. We are working with CDA Model School as a pilot. Thank you.
Thank you. Over to you, Muqaddar Shah Saab, lead population and development portfolio, UNFPA. So over to you, sir.
Dr. Sajid, in fact, we are in
Is it
a bit
working?
hurry because we have another meeting.
Is it
and I'm
working?
receiving calls continuously.
So,
one of the purpose, in fact, of this dissemination is to make all those visible who are invisible. So this study, in fact, in Pakistan, we don't have too much data, though I heard about that there's too much data in Pakistan. There might be data in every carpet, under every carpet, but that data is not standardized. That cannot be utilized. Even Gulnara was surprised day before yesterday when she heard about that even the SDGs framework that we have developed at the provincial national level, they are not unified. All SDGs framework, they are different from each other. And when you come up with the national figure, it is too difficult to come up with a unified one report on the SDGs. So that's one of the issues in Pakistan we have. So we have to come up with a very comprehensive, integrated, and responsive data ecosystem that can be utilized for preparedness, response, as well as for the recovery phase. And also, I would like to mention that in 2022 floods, the data which was provided to all those who are working in the response, areas, the data was not correct. Whoever provided to them, I don't know, but that data we had a lot of concern on data that was not according to the basis that was provided by 2017 census. Based on that, you have to come up with the projections at the districts levels. Unfortunately, the response data was not according to that. So we need to focus on how to make the climate to be integrated into Pakistan data ecosystems, which has to be utilized for the better preparedness response as well as further recovery. Thank you.
Thank you, Muqaddar Saab. Dr. Tahir, before I invite you for your last vote of thanks, we have a video message from Dr. Shazra Mansur. State Minister on Climate Change and Environment Coordination. She was abroad, so the time was really mismatched. So she has sent her video message. If we can play that video. If you wanted to see the video, you can go there.
If I can quickly
Yes.
commend UNFPA because they have supported National Commission on Status of Women, specifically on National Gender Parity Report.
Excellent.
And that's about the standardization of the indicators. It's a very crucial exercise. We have gone through the consultation, but we are moving into phase 2 of it, which is looking at the indicators that we need to collect data and the standardization across provinces. So thank you to UNFPA. We are on it.
Thank you. So we
Bismillahirrahmanirrahim. I want to begin by thanking the UNFPA and SDPI for producing this valuable study, Drought and Deluge, the silent suffering of women and girls in climate change. This evidence brings to light the often invisible impact of climate change, how floods, droughts, and extreme weather disrupt women's access to health, particularly sexual and reproductive health, and family planning services. The study provides a timely reminder that climate change is not only an environmental or economic crisis, it is a human and gender crisis. Pakistan is among the countries most affected by climate change, and our adaptation challenge is both developmental and humanitarian. Every flood, drought, or heat wave strains our public systems, health, education, and social protection, and these shocks hit women and girls first and hardest. The Government of Pakistan's National Climate Change Policy and updated nationally determined contributions both emphasize resilience, adaptation, and inclusion. This very helpful report and today's discussion highlights that our adaptation measures must go further to ensure continuity of essential health and SRH services during climate crisis, particularly for women in rural and low-income communities. The Ministry of Climate Change and Environment Coordination has a mandate to mainstream climate resilience across all sectors: health, education, water, population, and environment. Our focus is on breaking silos and ensuring that national commitments include those in our NDCs and National Adaptation Plan translate into practical community-level results. We see health and gender as core pillars of our climate adaptation agenda. The climate agenda cannot succeed unless it protects people's health, dignity, and reproductive rights. Moving forward, UNFPA's partnership will be vital in helping Pakistan strengthen the integration of gender, SRH, and climate resilience aligned with our national climate and NDC framework. Key areas where UNFPA can support the Ministry of Climate Change include assisting the Ministry in embedding SRH and gender-sensitive health resilience within the next NDC guide update, the National Adaptation Plan, and Provincial Climate Action Plans, and providing technical expertise to design guidelines for climate-resilient health systems, including emergency SRH services and supply chain resilience in high-risk areas. They can help us by training provincial and district health and climate officials on integrating SRH and gender responsiveness into disaster preparedness and adaptation planning. We can collaborate with SDPI and the Ministry to establish data systems that capture the gendered health impacts of climate events, feeding this evidence into adaptation and NDC monitoring frameworks. They can work with civil society, youth networks, local governments to promote community awareness and women's leadership in local climate resilience planning and help ensure that women's voices and health priorities are reflected in climate resilience and recovery programs. Pakistan must move forward towards climate-proofing social services, health, education and water through integrated planning and financing. A cross-ministerial task force on climate and health could institutionalize collaboration between the ministries of climate change, health, population, welfare and disaster management. UNFPA's global experience can guide Pakistan in developing a climate-resilient SRH action framework linked to both NDC implementation and sustainable development goals. It can be structured as a series of policy dialogues. As we conclude, one message is clear: climate resilience is people resilience. We cannot build climate adaptation strategies that ignore women's and girls' health, safety and dignity. Together, through evidence-based policy, strong partnerships and aligned investment, we can ensure that Pakistan climate response protects every woman, every girl and every community. I will invite UNFPA to sit with my team to develop a roadmap for this action. I thank UNFPA for all development partners for your continued collaboration with the Government of Pakistan, and my special appreciation for Dr. Gulnara, Deputy Representative UNFPA Pakistan, and to the entire UNFPA and SDPI teams for their dedicated efforts in producing this valuable evidence-based research. Thank you.
Thank you in absentia to Honorable Minister. For my, this is all. Now I will be handing over to Dr. Tahir for vote of thanks. From my side, it's all thanks to you. And Dr. Tahir, if I can invite you here for vote of thanks. And after vote of thanks, we will be having a group picture. That is the last ritual before the lunch. Then we'll be breaking up lunch. Over to you, Dr.
Assalamu alaikum wa rahmatullahi wa barakatuh. Just a little bit feedback before I go to the vote of thank. Number one is when the flood hits or when any emergency or humanitarian catastrophe hits a population, agencies like I'm working in or the agencies that are within the government framework, they watch and they start their preparation. And the first thing in preparation is a lot of meetings. In COVID and in the flood, I had no time, just meetings and meetings and meetings. While we were busy with these meetings, the local people and the local communities, they were responding immediately where people were affected. So I said this because it is important for resilience building. And that's why we are prioritizing in our resilience building strategic framework that is developed here by UNFPA to focus on the individuals, then on the community, and then the civil society organizations, those local NGOs, youth-led organizations, women-led organizations, they were the first one. Traders, they were the first one who reached out to the people, started distributing bottle of water, started distributing tents, food, and other kits before agencies do arrive to the scene or to the area. So that is really, really an important area. This is one thing. Just a little bit response on the colleague that was from Balochistan. There are traditions and cultures that may be an impediment in reaching out to women or empowering women. But I believe that the more you engage them in the response, the more you empower them so that they become able to be engaged in the response, these barriers will automatically and gradually be removed. That's one thing. The other thing is, this is community-led response. But then also if you engage the very same community in accountability, in the accountability to the affected population and also to the affected community, that is going to help find a way within those barriers, within the context, So our response will be much more contextualized. And one more thing, Pakistan is establishing a national strategy on the development of data of statistics, or data systems for data, or a system for its statistics collection and data collection. Muqaddar Shah Sahab did not mention that. Already there is a team working on this. And we provided some inputs. Number one was that all these systems that are going to be proposed, or the systems that are collecting data from different departments of different ministries, directorates, provinces, they need to have SRH, GBV, and SRH as core pillars of collecting of data. And one other issue that we did have is the data that we receive is usually not disaggregated sexually, diversity, age base, etc., etc. So that disaggregation needs to be mandated on different departments. When we collect the data, it helps us in everything. And the other important thing is linking this population data with the vulnerabilities that are created either by disaster or by a climate change. I think if you combine that, if you identify and know the vulnerabilities in Sindh, the geographic vulnerabilities in the population, you will be able to reach faster there and invest more in there. One last thing about this, there is a lot of time that is invested in this, human resources and also financial resources. If this is not used to inform your policies and your actions and your future preparations, then all these three kind of resources that we have invested in this, these are going to be wasted down the drain. So I would encourage every entity and the partners of UNFPA to utilize this, the evidences that are generated with this study, to inform. So thank you all. Today's discussion reminded us that climate change is not only an environmental crisis, it's a human crisis and profoundly a gendered one. The evidences that are shared through this study, it underscores that floods and droughts will continue to disrupt sexual and reproductive health services, and it will continue to disrupt the gender protection. There is a community-based gender protection umbrella that protects every woman, every girl. And if humanitarian or climate change hits any society, that protection will be destroyed. For millions of women and girls, these climate shocks have transformed the childbirth into a life-threatening gamble and safety into a daily struggle, as was mentioned by our colleague here. We need to ensure the uninterrupted SRHR services because births will not stop. GBV is already within the fabric of the society. Gender-based violence will exacerbate. Mental health issues are already there. They will exacerbate. They need to be continued. Just like as we mentioned that in COVID, the first thing we said is stop going to the hospital. No, that should not be the strategy in the future. We need to continue, and we need to agree on the basic and life-saving essential services and the commodities that are critical for saving those lives. So that should not be interrupted. Protection services for women and girls should not be interrupted. They should be prioritized. These are not merely humanitarian priorities. It is a matter of justice, it is a matter of dignity, and it is a matter of human rights. UNFPA remains steadfast in its commitment to supporting all the institutions that are working in these areas in Pakistan. We want to strengthen the resilience and preparedness in the face of climate-induced disasters, but also all other disasters that are man-made. Through partnership with the Ministry of Climate Change and Environmental Coordination, the provincial departments, whether it is PDMAs and also at the national level, the NDMAs, we will stay engaged. We aim to embed SRHR and GBV considerations at the heart of disaster risk reduction and climate adaptation frameworks that are going to be prioritized. So investing in resilient health system and empowering community health workers, just as were mentioned by our colleague here. And then integration was mentioned several times. But then the most important one is integrating gender disaggregated data into planning, and critical protection mechanisms will protect lives and will sustain the progress towards sustainable development goals in Pakistan. As we close, let us remember the stories behind the data, the woman who carried new life through flood waters, the young girl whose education and safety were compromised, and the communities that continue to rebuild with courage and hope. Their resilience must be matched by our resolve. Together, through evidence-based policies and coordinated action, and the unwavering advocacy of all partners gathered here today, we can ensure that every woman and girl in Pakistan not only survive the next disaster, but live with dignity, choice, and opportunity, no matter what the climate brings. Thank you very much.
सॉरी, पिक्चर आपको किताब के साथ लेना पड़ेगी. सो डॉक्टर रशीद, इफ वी कैन, आ जाए प्लीज. वो पंजाबी में कहते हैं ना, तू नहीं तो तेरी तस्वीर ही सही. आप तो मिलते नहीं, हम तस्वीर तो देख लिया करेंगे ना. आए. बिल्कुल, प्लीज गो अहेड. Participants also can join PDMAs and all those. So we can have another line here up. So please do join us. एक और लाइन बना लीजिएगा ऊपर. आ जाएं आप लोग सारे. एक जहाज आप भी आ जाएं. So all team can come in. Big thanks to my team from SDPI for engaging all this show. Umar, Samir, Aksa, Imran, and all those. Hamza is also here. So all of you, big thanks.